the only possibility I have is to do it flat. Okay, so sometimes it's good because if you are doing re-kneeling, you will feel the resistance, so it will relax. But sometimes if you want to be more precise in the nodule, you can trust on your feelings and say, okay, I'm going to relax a little, for example with this, and we are going to do dry kneeling in a pincer grip. Okay? So, where is the brachialis here? Brachialis, if we follow the tendon of the biceps here, we can find brachialis just medial, so here, or just lateral here. For example, here, I think this can be a trigger point. And this also,
This is the first one more, yeah.
This lateral, but this is the only place you can access the brachialis, because if you go a bit up, this is covered. This is in the second layer. Okay? Do you agree or not?
Yes.
Yeah? Okay. So, sometimes we have also to make some adaptations. I haven't introduced this in the previous practice, but when you want to work with the patient, you have also to find which is the more ergonomic way for you, and also to combine with the safest procedure. So, for example, when I'm working in the long head, it's usually very comfortable for me to be in this position, because in my mind what I want to work is in favor of the gravity. So this means moving like this, because, for example, if I wanted to do here, my finger here, I should do this or doing this. So I usually take two principles in my mind. One is I want to work in favor of the gravity, so always like this, or I want to work against me, so I'm more stable. It's easier to work against me than pushing. Okay, so sometimes it's impossible to have both of them. So for example, here it's very easy because I give support here, so if it's an orthopedic patient, it's not going to be a problem, but if I'm adjusting to a neuro patient, sometimes this allows me to give some support to stabilize. So I place and I'm working in favor of the gravity and working against me, so it's comfortable, I think. The problem is that if I change here, it's a bit complex because I have to push or I have to work against the gravity. So how can I change this to benefit? Do you have any ideas? Yeah. So if I do that and the patient allows me to do it, what I'm going to do is to be like this, okay? So I'm going to do in this direction, in favor of the gravity and against me. There is also one important consideration, and is that if I'm in this position, which are the main structures that I should avoid or may lead to some risk? Yeah, all the nerves and blood vessels here. So the approach, if I'm doing a pincer grip, here I don't have any risk. But when I'm doing this, I'm really interested to go from here to here, because even if I do this pincer grip, I don't need to reach to the nerve. But if I start here, I'm going through the nerves. So this is more dangerous, okay? So in this case, we are going to do this, but when we are doing this, we are going to change and we are going to adjust the position, okay? For example, if I want to do the brachialis, sometimes I can do it flat, because I can take this a bit apart, put my fingers, look for the top band and go towards the bone. Or imagine that you decided to do it flat in the biceps, sometimes you can look to the bone if we find some brachialis trigger points. The problem is that sometimes brachialis trigger points are usually a bit lower. So sometimes what we can do is to look for the biceps and then we make a big inclination of the needle and we go in this direction. Okay? So just different ideas or possibilities for you. Okay, so we are going to show it. For example, I think we can show with the pincer grip because the flat is going to be easy for you, I think. So the idea when I'm doing a pincer grip is that I'm going to grab this trigger point So I'm going to take the needle into this trigger point. So it's very important I spend some time being precise to take this trigger point, okay? So sometimes if I get in and I have a local twist response, it's going to move, so it doesn't matter. We are going to remove a little the needle and we are going to retest, okay? Because if not, we are going to lose effectiveness, okay? Déjame antiséptico. Okay, which are the needles we are going to use? So in this case, it's easy because you can calculate. So you say, for example, I can palpate. So if I'm taking this, considering that my fingers are closer than this, with 2.5, it will be enough. Okay, but if I have, for example, a peak like this, I will need more. Okay, so it will depend. For example, you are going to see this in the gracilis. For some people, the gracilis you need 2.5, and for others you would need 7, because it depends also in the fat tissue, in the subcutaneous tissue, okay? So if we see any local twist responses, we are usually going to see more or less like here, okay? Okay, if it's very painful, you just tell me stop, okay? Ojalá, so what you want. I will learn one word every time. Kebab. This time is kebab. Okay, I'm going to palpate while she's taking the time to do the asepsia.
Maybe this.
I'm going to check different. Yeah, this looks very good.
Mm-hmm.
So we agree. Okay, sometimes we disagree with the patient, so I say okay. Or I do both. Sometimes I do what you like most and what I like most, and sometimes okay, I win. No, you win. Okay. So I have the trigger point here. So the idea in my mind is that I have to go through the trigger point. So usually I need to leave a bit of space. So what I usually do is to put the needle here and like to push a bit just to be in the direction of the trigger point, okay? So 1, 2, 3. So now I'm going to move very gentle the first time. This is increasing the resistance. More here. So now I'm going to chain a bit. Okay, I'm going to do a bit here.
These
More.
switches.
Yeah.
Mm-hmm.
Perhaps, I don't know if you see them, but you can clearly feel them. Yeah. Oh yeah.
A big one.
Okay, so if I have any doubt and say, oh, perhaps I'm losing effectiveness, I don't find twitches, you say, okay, don't worry, you take this a bit out and you just take the trigger point again and we go again to the trigger point there, okay? Mm-hmm. So for example, if we were treating a neuro patient, just after local twist response, we usually feel a decrease in the resistance. So if we are fixing like this, we can even stretch a bit more. So we remove the needle and we insert it again. Okay, because if not, the needle is going to bend. Okay. So, ¿puedes pasarme lo de agujas?
El protector.